So good day. We are Team AI from the I Succeed program, and we are going to present our literature review paper entitled Attributes and Issues in the Application of Artificial Intelligence in Health Science Education, an integrative review. Team AI is consisting of faculties and academic managers from Far Eastern University and University of Southern Mindanao.
Artificial intelligence is transforming the future look of health science education. Even though most experts believe the critical presence of teacher is irreplaceable, there will be many changes to a teacher's job and to educational best practices. As AI educational solutions continue to mature, the hope is that AI can help fill needs gaps in learning and teaching and allow schools and teachers to do more than ever before. AA can drive efficiency, personalization, and streamline administrative tasks to allow teachers the time and freedom to provide understanding and adaptability, uniquely human capabilities where machines would struggle. By leveraging the best attributes of machines and teachers, the vision for AI in education is one where they work together for the best outcome for students. The purpose of the study is to determine the attributes and issues in the application of artificial intelligence in education as perceived by health science professionals and students.
For the methods, this study utilized integrative review as an approach of summarizing past research and drawing overall conclusions from the body of literature on the topics about AI application in education. It includes studies with diverse methods, as well as original peer-reviewed, published, and approved research articles about AI in health science education. The body of literature comprises all studies that addresses related or identical research questions on the effectiveness of AI. A search design was agreed upon by all authors to search on PubMed and ScienceDirect. Key terms search were AI or artificial intelligence or machine learning and health science professional education or undergraduate health science education and curriculum or learning or teaching. Inclusion criteria includes topics discussing about attributes, issues in the application of AI in education as perceived by professionals and undergraduate students in various health science disciplines to ensure that the information that is incorporated into the research is not outdated. The researchers stick to academic papers that were published between the years of 2011 to November 2021.
The author used Covidence software to screen the articles. First, we imported the 2116 RIS or PubMed format of the references into Covidence, and 535 duplicated articles were automatically excluded. Then we moved the screening 1,581 articles by title and abstract, where we decided by clicking on the yes, maybe, or no buttons for each reference. After we submitted our vote, we required two similar votes for each of the studies to be either included or excluded in the article pool. Two no votes will automatically move a reference to irrelevant, and one no vote and one yes or maybe vote will move a reference to the resolved conflicts area. After we have screened all studies by title abstract, our team resolved all conflicts. Then we proceeded on the screening of 1,576 articles. At this level, we selected an inclusion for any articles that we do not wish to include. If there was one vote for inclusion and one vote for exclusion, another reviewer's voting option acted as a tiebreaker and chose to either include or exclude it. If both reviewers have voted to exclude but disagree on the exclusion reason, another reviewer decided on the final reason for exclusion and assigned the correct exclusion criteria. This resulted in a total of 16 articles that are displayed in the studies for extraction. In this integrative review, we utilized the PRISMA review guidelines to collect information, analyze, and present data. On the right side is the PRISMA diagram.
For the bibliometrics, most of the articles came from the United States and United Kingdom. Meanwhile, for the methodology, Most use experimental methodology as well as mixed methods. In terms of the number of articles according to the participants, there is an equal amount of 50% each coming from the professionals and the students. As to the year of publication, the peak year is 2021, and lastly, the articles gathered has an average impact factor of 2.46, and there were a mix of participants coming from the health professional ranging from medical, nursing, ophthalmology, radiology, as well as pharmacy students.
The results revealed attributes and issues regarding artificial intelligence. The authors identified involvement of professionals and students. For professionals, these highlighted various attributes in terms of usefulness, immediacy, and reliability. Usefulness in automated processing of surgical recordings and online AI-based assessment and competencies. Immediacy in health communication by increasing authenticity and enthusiasm in health promotion efforts, interactions and reducing demands of healthcare staff. Reliability, integration of reliable sources of informations, intelligent information access system, learning activities.
For the students, AI-based application for students provide an opportunity to study in free time. Additionally, students can get feedback in real-time mode. AI tends to help students with their weak sides. AI offers interactive approach that allows the students to take an active role through participation, and it also encourages peer cooperation in class and on home-based assignments. AI enables the students the ability to use outsourced resources, enables them to find their solutions to the questions, thereby boosting their self-confidence and help improve their clinical skills. Those students who find answers themselves will feel a greater sense of accomplishment than those who rely on textbook or teacher-led learning.
In the combined perspective of healthcare professionals and undergraduate students, they view the application of AI as a robust source of accurate information. It also provides interactive learning where students can demonstrate empathy and practice communication skills by simulating actual scenarios. It creates intelligent virtual human agents to serve the role of online healthcare guides, coaches, in an effort to break down barriers to care. It also aids in intuitive strategies that ignites their critical thinking ability. It improves nurses' clinical reasoning and detection skills in home care and community settings. It provides means to exploit huge video repositories available in the hospitals. The tool is intuitive, easy to use, and robust, and is accessible to any medical professionals regardless of their experience with computers. Also, AI deployment does not harm the humanism enshrined in medicine's Hippocratic Oath and offer opportunity to explore innovative pedagogical solutions that could help the students develop their skills in safe learning environment.
In this integrative review, the researchers have identified 8 artificial intelligence application issues. As for the readiness issue, the results have shown that teachers find the inclusion of the systems in learning activities to be undoubtedly efficient. This study provides a systematic understanding of how intelligent information access systems are appropriately incorporated into learning activities. As an outcome, such insights are relevant knowledge to consider when developing such approaches. For the issues regarding technological resources, this study emphasized the use of applications, specifically medical devices, is extensive. Given that numerous applications have their differences in providing services, it raises quality and consistency issues. The results have shown that usage rate pattern and lack of awareness for the applications are rampant among the participants of the study.
Another issue that was identified is leadership. Leadership is an important attribute to facilitate the integration as well as the continuance of the success of the artificial intelligence application and usage. In the article of Barbour et al., one of their key findings is that to accomplish this, Medical practitioners should serve as leaders of integrating AI with clinical practice. For the issue of security, there has been a finding in the article of Gan et al., of which the security of the weblog is limited to accessing the number of attempts students made to log into the courseware, yet failed to factor in duration of the courseware. This is one issue that is imminent since we are on the verge of uploading so much data, and security that is one big factor to play in considering the safety of the data.
A cold machine, warm bodies highlights humanism. This concept leads to baseline beliefs about how AI will affect the future of healthcare careers and patient care. Overall, we interpret the results as showing the importance of educational programs designed to advance the understanding of AI systems and the necessity of ensuring AI deployment doesn't harm the humanism enshrined in medicine's Hippocratic Oath. Meanwhile, having a meaningful shift in attitudes regarding the desire to take a leadership role in developing or implementing AI. While research opportunities spurred in investigating AI in health science education, ethical issues are involved in the process of creating and interacting with virtual humans in a clinical context. The ethical challenges may be more intuitively appreciated, however, the functional technology challenges are also significant, such as the need to respect and protect patient autonomy, the role of non-human therapy, and transparency in the use of algorithms.
In a study conducted by Christian Park in 2021, it was observed that medical students are hesitating in utilizing AI as they believed some field in medicine will be greatly affected and will then in return be obsolete. And for example, in radiology. As for the pedagogical refinement, in a study conducted by Shefali Shori in 2019, even though they have suggested that AI applications are capable of providing students an interactive, intuitive, and safe learning environment, there are still needs to refine the pedagogical applications of these AI mechanisms.
For the conclusion, we give you this acronym AI in AI, which means attributes and issues in artificial intelligence. AI application in health education has its attributes and issues. AI has numerous promising contributions to health science education, both for professionals and students. However, there is a need for further refinement and resolution of certain issues to achieve its fullest potentials.
Again, we are Team AI from the I Succeed program. Thank you for listening.